Hi, everybody. Welcome to a webinar today with the Devon Alliance for International Recruitment. My name's Laura Travers, and I'm here today with Helen. Hi, Helen.
Hi, Laura, and thank you so much for inviting me to come and talk to you today.
Absolute pleasure. Why don't you tell us a little bit about yourself?
So I'm a registered nurse, and I work in this capacity. I'm working with C3 Collaborating for Health, and we're C3 is an international global charity, and I'm one of the associates in nursing with that charity. So C3 is about the prevention of what's sometimes referred to as non-communicable diseases. And those are the diseases that, yes, sometimes they're due to family history, genetics, stuff like that, but more often they're due to the way people live their lives and the things that they do or the things that they don't do. So we put it down to three key areas that we want to try and prevent. Smoking, obviously, top of the pile, and then obviously what people eat and drink, and then increasing the amount of physical activity. And those factors will all help to improve people's overall well-being. So mental health comes into it across the piece. And it's those diseases like diabetes, cardiovascular disease, respiratory diseases, many cancers. And the WHO reckon that about 70% of those diseases could be prevented if people made changes to their lifestyle. So there's a huge amount that we could do, basically.
Yeah.
And that's what C3 is about.
Amazing. So I know recently you've been working on a wellbeing kiosk. So tell me about the kiosk.
Well, the wellbeing kiosk is about supporting staff in adult social care settings. Now, so we know that the adult social care workforce is huge and very much needed. I think that came to light when we saw all of those classic terrible images during the COVID pandemic. But, we're an aging population, there's increased demands. So, demand for care in lots of settings is a huge need within our society. And the adult social care workforce, I mean, depending on what you read, 1.8, 1.6 million people. But we also know that they are very poorly paid. And, you know, poverty has a detrimental effect on people's overall well-being. So the well-being kiosk has come about from some work that started in North Central London, ICB area. And what they were doing was they were going around to care settings with what they called their well-being bus.
Okay.
And the well-being bus was about offering people the opportunity to have a health check. I mean, one of the key indicators was that people, because they're working such long hours, and don't have access to the resources, they didn't even manage to get to the GP very often to have routine checks. So going in with the bus, for
Right.
lots of different reasons, that bit of it stopped.
Yeah.
And but we put in a bid with the Integrated Care Board, with the Burdett Trust for Nursing. And the Burdett Trust for Nursing and C3 have got a long history. We've done lots of bits of work with them in the past, a lot of it around nurses' health and well-being. And we really wanted to look at the social care staff health and well-being. So the well-being kiosk is really about offering those staff the opportunity to do a quick health check.
Yeah.
And the kiosk, it's a bit like, looks a little bit like you see those blood pressure machines in the chemist or the GP surgery,
Yeah.
but
With
it
the
asks.
thing on the top and the
Yeah, that's
yeah.
right. So, you put your wrist in, you take your blood pressure, you take your weight. There's a height measurement next to it, so you do your height measurement, but it also works out your body fat. It
Okay.
works out your hydration. And it also asks questions about what you eat, what you drink, your smoking habits, your sleep, your rest, your relaxation. So it gives people an overall pattern and an overall measurement of, how well they are, and from that, then advice on what they can do about it. So alongside the kiosk, and this is really important, there's a program called Habits for Health, and it's just what it says on the tin. It's changing our habits to improve our health.
Yeah.
And the idea is that people can sign up to that. They can do it in their own time with support from wellbeing people, but also from us, and hopefully make those small changes that will improve their overall health and their well-being. So the project itself is called Your Health, Your Well-being and Your Numbers. So your health and your well-being is self-explanatory. The your numbers bit comes from the idea that unless you know what your blood pressure is, unless you know what your BMI is, do you understand things like 5 a day? What is a unit of alcohol? All of those sorts of things. So it's trying to give that sort of information. I hope, yeah, that's a bit of a long-winded answer,
No,
but
no, it's
it gives the
great.
background. Yeah.
The thing that I liked about it as well, and when we talked before we met, was the fact that it's not just the kiosk going everywhere. It's a whole holistic approach, isn't it? So you support the attendance to the kiosk with like extra webinars and things like that. How does that work?
Yeah, so I mean, the project itself, we got funding from the Burdett Trust for Nursing for a 3-year period, and there are several elements for it. The first bit was to offer well-being checks, the idea that if you know what your health, your baseline health is, then you can do something about it.
Yeah,
Um, but then, as you say, to try and offer interventions to encourage people to use the kiosk and then what they can do afterwards. So I think that's the bit more challenging bit because, these staff very often they come from other countries. We know from the data there's a very, very wide ethnicity, and particularly in an area like North London. So, the language and the ability to access resources, the ability to have that family support around you, if you've come from a different country. So that's the challenging bit, and that's the bit that we're working. So we're working with the local authority, we're working with the Integrated Care Board with different options. So webinars being one of them. Myself and my colleague Lola are also going into the care home settings when the kiosk is there to sort of
good.
encourage people to use it.
Great.
And we've got some other ideas that we're going to take forward
Yeah.
to see how that goes. But to date, so we only really got this kicked off at the beginning of this year, and we've already completed nearly 800 health checks.
Wow. And you've got another
Yeah.
2 years to go for the project, so
Well, we've been into 15 care
it's
settings, and we've
great.
got another 15 care settings that we need to do. So
Great.
part of the next two sort of, well, it's the next another year that we'll be going into care settings, and then a year that we can do some other follow up and,
Of course.
promotion and
Yeah.
that sort of thing. Yeah, yeah.
That's great. So how long does the kiosk stay in a setting for?
So generally it's just for a week. So
Okay.
we arrange that with the care managers. So they deliver it. Often it's on a Monday. So I'll say Monday for argument's sake. Sometimes it's
Yeah.
different days of the week.
Yeah.
And then they pick it up the following Monday. But before then, we will have done some work with the care home managers so that they can get the sort of information about the kiosk that they can distribute to their staff, but also the information about the habits for health that they can distribute. And then we go in, as I say, either myself or Lola will go in at some point during that week to see how they're getting on. We've also developed a pack that we give to the care setting with all of that information. So people have got a sort of hard copy that they're not looking at everything on their phones. And, all the care settings, as you will know, they're all different. They're all independent organizations. So, it's a question of balancing what works for each individual setting, really.
Cool. Yes, of course. Yeah. Do you think it's been well received, the kiosk?
Yes, I think it has. I mean, people are very enthusiastic when we go. Whether we get everybody who should be going, I mean, we have a few people sort of say, "Oh, well, I know I'm overweight. I don't want you to tell me," and that's part of it, isn't it? I mean, that's always going to be the way. So it's how you motivate people to say, well, okay, well, can we help in sort of supporting you, if you know you're overweight, and it's those sorts of motivational approaches that as nurses, Lola and I, we use that all the time.
Yeah,
So it's trying to balance that, and of course these are care staff, so they probably use that with the residents, with their clients as well.
yeah,
But do they use it on themselves? It's they're
yeah.
giving care all the time, but not actually thinking about their own well-being.
Just gonna look after them. Yeah,
Yeah, yeah. So, we know when we look, the data from the King's Fund, from the Health Foundation, they tell us, it's a challenging area. We don't have enough staff in the sector. We
yeah,
also know that staff move around a lot. So one of the things almost is if we look after the staff better
yeah.
and they look after themselves, will they stay?
Have
And
a good
obviously, that's a
retention.
very big question and probably something that we can't really answer in a 3-year project.
Yeah,
But it makes sense. We know from other occupational health type initiatives that that does work.
yeah,
And I wouldn't say that they're forgotten, but probably in relation to NHS staff, they probably are forgotten as a
yeah,
workforce.
yeah, yeah. No, yeah, that's not surprising at all, actually. Um,
Yeah, yeah.
have you discovered, so far, have you discovered any surprising findings?
Well, I guess it's not really surprising. As a general rule, smoking isn't a big issue amongst this population, and also alcohol consumption doesn't seem to be a really big issue. But there are a lot of people who are overweight. Their BMI is higher than we'd like it to be.
Yeah,
People with blood pressure, higher blood pressure, and maybe undiagnosed blood pressure, which is worrying. Whether that's surprising given the population that we're serving and the fact
yeah,
that these are often people that have come from other countries. I'm not convinced I am surprised, but it is worrying, and it does sort of probably confirm a lot of that in, inherent beliefs and inherent thoughts that we might have had beforehand. Yeah.
yeah. Do you think that it is our overseas care workers that need that little bit more support?
Again, I'm not sure that we've got the data to know whether it's the overseas care workers. We know that a lot of the care workers are from originally from other countries.
Yeah,
It's just that population in general, and I
yeah,
think that they work long hours.
yeah,
They're often working at times when they're not able to then go and access healthcare themselves.
yeah,
They often have lots of requirements of them out of work as
yeah,
well.
yeah,
Particularly working in an area like London, they may have long distances to travel to get to and from their place of work because,
yeah.
North Central London's not a cheap place to live.
No,
So it's all of those sorts of things. So I don't know whether it's the overseas
yeah,
workers, but we do know that there is a huge divergence, ethnic divergence within that population.
yeah. Oh gosh, that's so interesting. Did you have anything that you wanted to specifically say about the project?
No, not really. I mean, we think it is a really exciting project. We think, as I've said, this does seem to be that hidden, forgotten population. And as a public
Yeah,
health nurse by background, it's the
yeah,
underserved populations that is always intriguing for me. And how do we best do that, serve their needs really?
yeah,
And I think this is just the start. 3 years is always a challenge because what do you do at the end of the 3 years? We're a charity, we don't have funding to just carry on.
yeah,
But there are lots of thoughts that, the learning from this could be used more widely.
yeah,
Um, And one of the reasons that I caught up with the Devon Alliance, because obviously your whole raison d'etre is about international recruitment and retaining staff, and I know that you and your colleagues are quite interested in it. So I think it's about pushing that agenda forward
Yeah.
and hopefully giving some learning, and some maybe ideas of what not to do, because as I said, the engagement of the staff is something that we're grappling with at the moment. So if we can give people some ideas, well, don't try this, it didn't work very well, it does help,
Yeah.
or you could try it this way, sort of thing. Yeah.
Yeah, I really like the idea of actually getting out there and seeing people face to face. I think since COVID, we've been very comfortable with doing our Teams calls, doing our Zoom calls, and having those online meetings. But there is something for getting out there and seeing everybody face to face and actually looking at people in the eyes and seeing that they're
Yeah.
okay.
I think it's a balance though, because what we are finding is that it's staff being released to access these sorts of things.
Yeah,
The work is pretty full on, and of course the
yes,
residents and the clients in the homes have to take priority. So sometimes having online stuff that people can access in a 10-minute break or in a little gap that they've got.
yeah,
So we are trying some face-to-face sessions, and we'll see how those go. But I think there's always going to be a need for probably a blended type approach to these things.
yeah,
Yeah.
especially when their time's so limited as well. But just in the
Yeah,
initially,
absolutely.
just for that
Yeah. I mean,
engagement, just to
some of the
be.
stuff that we found is that some of the staff they're not allowed to use the internet while they're at work.
Okay.
So it's sort of like, maybe that's something, that a message for some of the overall organizations, that, obviously I can understand that they don't want the staff to be on, social media and stuff like that during the
Yeah,
working day. But if it's something
yeah,
that's going to help them, so there are some sort of lessons that are already becoming clear, that we need to, and staff being given the opportunity to do things that are good for them
yeah,
during the working day.
yeah.
Yeah.
Oh, that's really great to hear. And the fact that guys are doing some really great work. It's fabulous and long may it continue. And we can't wait to hear the results at the end of the 3-year period. So we'll definitely bring you back to talk a little bit more about it.
Okay.
Thank
Well,
you.
thank you so much, Laura. I really
Thank you.
enjoyed this conversation.
Me too. Thank you so much for your time today, Helen. And take care. Thanks everyone for
Take,
joining us. Thank you.
thank you.